Good morning, Malaika Pediatrics here again. We are still continuing with our series on adolescents and the teenagers, children. And today we just want to cover a few things that, regarding their mental health that could be affecting our teens and our adolescents. So one is anxiety and stress. So these are children who are anxious about their schoolwork, they're anxious about their friendships, they're anxious about their families, and so therefore they could be expressing this stress in their day-to-day activities. These are children who also might be having depression. So you have a child who's constantly sad, is not able to sleep well, is not able to, take care of themselves in terms of grooming. These are children who might be having headaches. You notice a sudden change in their feeding patterns. They are eating a lot, or suddenly they are not eating at all. They don't want to go out and, play or even, meet their friends. So that's a child you want to be, you possibly might be having depression. At times they even express ideations of suicide, and so this is a child you want to look out for. At times they might be having peer pressure. Remember I said that these are children who take a big consideration when it comes to the opinions of their peers. At this point, mommy and daddy don't know anything actually. So the peer, opinion is really what they take as the Bible truth. If the peer says you're too fat, that's what they take. If the peer says today, you're too dark, your skin is too dark, then that is what, they take as the Bible truth. And so there's a lot of peer pressure, and this peer pressure can also come in a different way in terms of drugs, in terms of sexual exploration, so this, you need to be careful when it comes to the peer pressure. So self-esteem is also another issue. Their bodies are changing, and therefore, for the girls, they are having broader hips, they have skin problems, they could be having acne, they could be having, menses. For the boys, their shoulders are broadening, they're becoming taller. At times their limbs look as if they are longer than their trunk. And so these changes might arouse some anxiety in the teen. They also might be experiencing sleep problems, So, a child who's not sleeping enough as a result of probably even their hormones. These are children who at times are, quite exposed to the social media, and so they might be, clicking away the whole night. So, and therefore affecting the sleep. And if these children are sleep deprived, the following day, they actually manifest in their day activity. You find the child is not able to concentrate in school, is not able to concentrate in physical activity. And so these are some of the concerns that we might have with our children. Remember I talked about the prefrontal cortex, which is responsible for cognitive. For these children, is not well developed, so they are not able to regulate their emotions properly. They are not able to regulate their, and as a result of not being able to regulate their emotions, they might have sudden mood swings, suddenly very happy, suddenly very sad, And so as a parent, you come in to be able to help with regulation, So these are just some of the concerns that these children might have. And so we as adults, we as healthcare givers, we look out for these issues in these children, and we help them cope appropriately.